Welcome, everyone. We're going to go ahead and get started. It is shortly after 7 o'clock, just a moment. You may have remembered from actually, I should introduce myself. I'm Dr. Devin Fisher, and my host here.
Hi, and I'm Dr. Taylor Newton. Nice to see you.
You may have remembered, if you read some of the introductory course materials, that I have developed a love for virtual backgrounds on the Zoom platform. This is one of my favorites, and it's a nod towards our discussion last week of Kafka and absurdity.
Bug. Yes, the bug.
I will probably change it here in just a moment so that you don't have to look at a giant bug for the entire meeting.
You know, in the South, in North Carolina, it's a little bit too close to my my living room from time to time for comfort. Welcome, everybody, to the 5th week of COVID class. This week, we are going to be talking about pandemonomics. Dr. Fisher, is that how we decided that we're pronouncing this? Pandemonomics?
Something like that. I think we kind of went back and forth on a number of them, and
we joked at one point, right, that one of the spellings looks like the study of all demons, like
yes.
Pandemonomics. But that's not what we mean, right? So we're talking about economics tonight and how the pandemic has influenced that. And our format tonight is going to be, as with past weeks, we are going to hear from our guest professor this week for about 10 or 15 minutes, and Dr. Fisher will introduce her shortly. Following her brief mini lecture, we will jump right into some question and answer sessions. So you might note that there is the option either at the bottom or the top. I've been told it's in one of those two places. There's a Q&A option. So we highly encourage you to submit your questions there. There is a good chance that we won't be able to get to all of the questions, and not even all of the excellent questions, unfortunately. But we're really looking forward to being in conversation with you, and it's asking those questions that enables us to do that. So thank you for joining us here this evening.
And I will mention as well that there is a chat feature on the YouTube channel. You could type in questions there as well if you happen to be on YouTube. Before we jump into introductions, there is one announcement that I remembered that we need to make, and that is that tomorrow is my host, Dr. Newton's birthday. So a happy birthday to Dr. Newton. If this were like a live class, it is a live class, but if we had everyone participating as Councilwoman Williams is suggesting, I would give a rousing happy birthday chorus. But since we have all mics muted from our participants, that would just be me singing, which would not be a happy thing. So
maybe later, Dr. Fisher, that would be great.
Happy birthday. Our guests tonight, we're fortunate to have two of my wonderful colleagues, actually. One who I guess is still a colleague, but has recently moved away from Lenore Ryan in a full-time capacity, but I think is still going to be teaching some. Our first guest, Dr. Tunay Oguz, joined Lenore Ryan in 2015 as an assistant professor in the Charles M. Snipes School of Business and Economics. Her doctoral degree is from the Department of Economics at the University of New Mexico. Although her background is actually quite diverse, it's not just economics. Dr. Oguz holds a BS in textile engineering. I didn't know that. I'm learning stuff tonight. From Çukurova University in Turkey, and an MBA in finance from the Anderson School of Management at the University of New Mexico. In both her teaching and scholarly interests, Dr. Oguz is very interested in the ways that we can improve the lives of vulnerable populations, including minority groups in the United States and women and children in developing countries, particularly when it comes to healthcare access and nutrition. Dr. Oguz has received a number of national awards and recognitions. She received a Graduate Student Research Award from the National Association of African American Studies and Affiliates, the Rhonda Williams Prize from the International Association for Feminist Economics, and the UNM Graduate Success Scholarship in 2013. Also joining us tonight as kind of our special guest commentator, Councilwoman Charlotte Williams, who like Dr. Oguz, is committed to helping people and improving the quality of their lives. She's done this through her professional work and her community service work. One of the things that makes Councilwoman Williams particularly well qualified to speak to us tonight are the roles that she has played in both large cities and small towns. So she is originally from the Chicago area, where she graduated from the University of Illinois, Champaign-Urbana with a bachelor's of social work. Her degree in social welfare and public policy is from the University of Chicago. She worked initially in mental health and medical social work, but then later took a position with the mayor's office for the city of Chicago, working as an assistant deputy mayor in health and human services. I didn't know that either, so I'm learning lots about my colleagues tonight. So you can see Councilwoman Williams brings experience from one of the largest cities in the country, but moved to Hickory in the mid-90s and began teaching at Lenoir-Rhyne University. She retired from that position in last month, actually, May 2020, after having served as the Associate Dean of Engaged and Global Learning and the Program Coordinator for the Interdisciplinary Human and Community Services major. She oversaw the William and Robert Shuford Center for International Education, which recently received a $5 million endowment from the Shuford family. So amazing work that has come from Professor Williams when she was at Lenoir-Rhyne, but she is now serving on the Hickory City Council, recently elected as a 4-year term, and has recently served on the Hickory School Board of Education. So please join me in welcoming Dr. Oguz and Councilwoman Charlotte Williams. So thank you both for being here with us. And I'll turn it over to Dr. Oguz now.
Hi, everyone. Again, thank you for inviting me to this webinar and letting me share my expertise with you. I hope during this week I didn't confuse you further and I was able to provide some useful information about this COVID-19 economic crisis. Well, today in this short presentation, I will briefly go over what we covered in the recorded lecture to just remind you our learning objectives for this week. But also I will provide 2 possible scenarios for the future, and I will try to give a couple hints and tips on how we might respond to these possible scenarios in the future. So let's start by reviewing again how macroeconomic indicators has changed in the United States after the pandemic. Remember, we had 3 macroeconomic goals that we keep an eye on to assess a country's health. Those were GDP, unemployment rate, and inflation rate. We expressed that the GDP is a closely watched measure of economic health and allows us to capture the size of an economy. And one of the most important component of the GDP was the consumer spending, which has a huge impact on the overall GDP, and it is the main driver of the economy. So if you remember, I mentioned that this consumer spending was at record high before the pandemic, and then it went down about 14% in April and bounced back actually quite a bit in May. But still, we are worried about this number because it is still lower than February levels of consumer spending, about 8%. Well, keep in mind that these consumer spending numbers might be inflated a little bit because of the stimulus package and increased unemployment benefits. So I'm very curious actually to see what these numbers will be in the upcoming years, and because this is going to be determining how long this recession will take. Another key component that we talked about was business investment or business spending with the capital investments. This number was already slowing down in 2019. So if you came to me in December in 2019, I will say that, well, we are worried about recession, because this is an indicator that it was showing the signs of the slowdown, and businesses were not really sure about their future profitability even at that time. So we will see further declines in this business spending, and we will keep an eye on this as well. So to give you a brief reminder about the unemployment rate increased to 14.8% in April from 3.5% in March. Although this improved in May with 13.3%, this is still higher than the 10% unemployment rate during the Great Recession. So you can see the magnitude of the recession currently. So let's switch our attention to the policies in place to address the COVID-19 economic crisis. So in general, to respond to economic crisis caused by any reason, we have two policy options. One choice would be not interfering with the market and choosing to do nothing about it, right? That's an option. And in that option, we would be letting the market to work itself out. However, in general, the fear with that approach, it's not politically cute to do that, by the way, right? But the fear with that approach is that natural market forces can take years to stabilize the economy. And there's always a possibility of a recession to turn into a Great Depression. So this approach, we call it classical approach, has been used since the Great Depression. So the one approach that almost every country uses is called Keynesian model, where policymakers take on the role of stimulating the economy and to fix the economy. So they try to fix the economy. It is important to recognize that the Keynesian model, which is trying to provide short-term fixes, short-term corrective policies, have unexpected consequences. So we might talk about those later if you would like. But we will keep that in mind when we are talking about the some questions you might have. So in the recorded lecture, we looked at the two policy approaches in place in the United States, and those are in line with the Keynesian approach. So this was fiscal policy and monetary policy. So Congress used the fiscal policy. You already know that the CARES Act, this is the biggest fiscal stimulus package in modern American history. This provided a stimulus of about 10% of the GDP. So it's a big one. And the central bank used the monetary policy to change the interest rates to keep the economy and financial markets running smoothly. So what the Federal Reserve did was they increased the money supply, they lowered the interest rates to give consumers and businesses incentives to borrow more and spend more. So now we remembered what we covered in the recorded lecture. I think we are ready to think about the future and what the future might hold for us. I don't want to sound pessimistic. I'm hoping for the best, but I want to be prepared for the worst. Therefore, I have two, not sounding well, scenarios for you. In the first one, the pandemic might persist for a long time. And if that's the case, we might see that recession will be longer and the markets will continue to fluctuate. In the second scenario, a vaccine will be developed, fingers crossed. In this case, current policies will be withdrawn from the market slowly. For instance, the Federal Reserve slowed down lending activities or quantitative easing, and they're going to say that the party is over. And when they start to do that, they will start to increase the interest rates. And in general, when they do that, the markets don't like it. Whenever the Federal Reserve starts to even signaling about increased interest rates, the market starts to fluctuate because businesses are already highly leveraged. In any case, what I'm trying to say is we will see that with the second scenario, we will see like recession-like signals in the market, and the market will still continue to fluctuate. So my guess is the next year will be a bumpy ride for all of us, and we need to be prepared for this economic roller coaster, both professionally and financially. So, so what can we do? I want to spend more time on this, but I think that will be another lecture. Briefly, I can say that how each of us will respond to that question will differ based on our current circumstances. Unfortunately, this crisis comes with this information noise that can be distracting. I mean, sometimes my head hurts to try to keep up with everything. And I'm sure you felt the same way during this week when you're trying to follow my lecture. I know that it was hard to follow with that. In any case, I think staying up to date with the new information, developing your critical assessment of that new information, and avoiding undue speculation is important to getting and remaining prepared for the uncertainty ahead of us. I know it is hard, but another suggestion for you is to review your personal finances, maybe set your personal and financial goals and make a list of action plans to reach your goals, but make sure those goals are flexible and easy to or adaptable as possible, as much as possible to the different scenarios that as they may emerge. So yeah, I know it is going to be hard, but we can talk about that later if you like. So this is my 2 cents for the introduction.
Thank you, Dr. Oguz. I know I certainly have some questions for you, some things that you just even in the conversation here that came up in my mind that I'm maybe starting to understand a little bit. But before we get to those questions, I want to give Councilwoman Williams a few minutes to talk about what's happening locally here in Hickory. A shout out to our Asheville and Columbia audiences. This was one of those awkward cases where we would love to have someone locally from Asheville and Columbia, but I don't think we knew anyone. So we maybe should have done a little bit more research on our part, but we will benefit from hearing about the Hickory economy, and I would encourage you to think some about how is this playing out in your own space. So, Councilwoman Williams, I'll turn things over to you for a few minutes.
All right, thank you. And that was fascinating. And I think the macro view is always important, and it gives me actually reflection on what's happening in our local community right now. And we did talk about even extrapolating to Asheville or Columbia, but as you know, even looking within our state, every community is so different in population, socioeconomics, just a lot of different factors play into how each community is handling the COVID impact. One of the things, this is very timely because we just had to put together our 2021 budget. And it was really based on some of the things that Dr. Oguz talked about, having to really look at what's happening currently, assessing what the stimulus package and unemployment is doing, because our third and fourth quarters in terms of revenue have not been horrendous. We were really expecting some really shortfalls and sales tax decreases. Actually, the sales tax stayed the same, I think April of this year as it was last year, which was a very good year. Now, we've joked that everybody's shopping at Lowe's, you know, home and garden and doing home improvement. But, you know, at this point, some of what you're saying, the unemployment has kicked in terms of unemployment checks and money for that. And we still haven't seen what's going to happen if this continues for more than 6 months, a year, 2 years. But so the other interesting thing in our local economy that's maintained at this point is building. So when you think of investment, economic development, jobs, and you know, building, because property taxes really are what sustain a local government, we've really had not a downturn in that, which is another interesting phenomenon. And I guess I would go just with some history. Hickory was one of the hardest hit areas in the whole country because of our large manufacturing history in the 2008 downturn. So I have to credit what happened during that point, where the community leaders, both public and private, decided to put into place some incentives, some really some programs, our commission bond, all the things to stimulate economic development, to pivot us even from manufacturing to bring in other types of industries. That has worked. As the economy opened up, Hickory has benefited. We went from the highest unemployment rate in 2008 to one of the lowest just before the pandemic hit. So I think we've been cushioned in that way too. The bond projects, including our Trivium Industrial Park, we have 3 major international companies that have moved in right now, which are still in the future going to provide new jobs. Within the last 2 months, we have an Atlantic company from Atlanta that's brought in some a new spec building that's going to bring in more people. So we're in that in-between stage where we're still riding on the coattails of everything we've put in place. We're hoping that that will continue. You know, we are a unique place where we have lower taxes. Even in this downturn, this may be actually a location that's a little more attractive than some other parts of the country. So we're really banking on that.
Thank you. Actually, the first question that I have, just to kind of get us kicked off with things, may actually be for both of you, but just a little bit of a different take on it. So there are 2, I'm not an economist. I will just tell you straight up. I don't know that I've ever even taken an economics class. That's awful of me to say, and it's something I need to remedy sometime when I have space in my schedule. But 2 of the things that I know from listening to the radio or watching the news that are really important indicators of economic health are the stock market and housing. And at the national level, I mean, I'm fortunate to have a little bit of money in the stock market for retirement accounts, and I was terrified of what was going to happen to that. I know enough not to go pull all my money out right away, but wondering why it is that the stock market generally seems to be doing reasonably okay in this. It hasn't tanked like it did in 2008. And then the other piece of this housing, I'm in the middle of taking advantage of the low interest rates and refinancing my house. And the appraisal came back and I went, oh my goodness, I've only lived here a year. How have prices gone up when it feels like they should be dropping significantly because people don't have money to spend? So again, one kind of a national level, one a very local one. And maybe Dr. Oguz, if you can talk to us about the stock market first and then.
Well, about the stock market, I think our assumptions change along the way that change the valuations. So again, if I can link to my presentation, if you came to me during December and if you asked me whether or not to invest into the stock market, I will say, I mean, I usually don't make this kind of investment recommendations, but honestly, even for my own personal reason, I wouldn't invest in the stock market for several reasons. Because if you if you look at the prices, stock prices, there are certain things that we look to see if the stock market is doing well or not. One of them is the growth potential, which I mentioned that with the business fixed investment, we weren't seeing that businesses are investing in new projects, right? So that was worrying me, because if they are not investing in new projects, if they are not taking that chance, that means that they are not taking the risk. So we are going to slow down in terms of economics growth in the future. The second thing that would worry me is their, riskiness, which is usually we look at their debt ratio. If any of the finance students are here. So we already saw that businesses are highly leveraged. They were highly leveraged even in December or during the 2019-18. And they were taking the debt, not using for the business fixed investments. What they were doing is they were buying back their stocks. And which in that case, that was, they weren't keeping their cash on hand. They weren't investing. They were buying the stocks back, which was increasing the, we call it financial engineering, and it was increasing the stock prices because there's a demand for the stock. So, and investors do not complain about that, because as long as they have the capital gain, they are fine, right? But we already knew that, for example, for the companies, another indicator is PE ratio. How much we pay for their earnings is record high ever. So all the economists I know, they were expecting the stock market correct itself in 2020. But then the pandemic happened, and that was the one thing that, I had this belief that yes, we are going to have the correction. Yes, we had about 30-35% correction at the end of the March, but at that moment, even I was hesitating to get back to the market because I wasn't sure how the things are going to play out. But what happened is the central bank changed the rules in one day. And then because of that, the assumptions and expectations changed right away. And I was slow to adapt, but financial world is a very dynamic place for an economist, I guess, because we are generally we look at, backwards with the data and we say, oh, the economy is, doing bad. But then finance people, they're like, okay, it's bad, but it is not terrible. Yay. So they start to invest. So they had that optimism about, yeah, things are bad, but we have the fiscal policy and monetary policy. They are going to support the companies. They are not going to let the companies to go bankrupt. I think the efforts with the central bank, it was too soon. And it was too much. In general, the central bank, they do something and they wait and see what will happen. And then they change their policies, but they didn't do that. That was the first time I saw that they were like very fast in adopting so many things at one time. And that gave the, I think, investors the confidence that, well, if something happens, if we have the downturn, well, we know that the Federal Reserve is going to act as a backstop, and then we are going to be okay. And then I'm not going to miss out the opportunity of the upside. So I think the Federal Reserve and the increased liquidity with their increased money supply policies pushed the people to be confident. And I shouldn't say confident, but I think they were slowly seeing that it's a reasonable point to enter to the market.
Dr. Oguz, there's a good follow-up to what you were just saying. We'll definitely want to hear from Councilwoman Williams on housing, but one of our attendees asked about gambling on the stock market, that gamblers have turned to the stock market because there's no sports betting, right? And that's also affecting the market.
People couldn't go to Vegas, right?
Right.
Wasn't the stock market gambling in the first place?
But yeah, I think we saw a big increase in the day traders, and like people were home, like me, I'm bored at home. I don't want to go out. What am I going to do? Well, I'm gonna invest in the stock market because that adds a little bit excitement to my life. So yeah, I definitely say, I can say that that was an impact. That's a true observation.
Is there gambling in housing, Councilwoman Williams? So
well,
Fisher's question from before, does it connect?
This has really shown us kind of the just the variation we have in our community. The people that have significant amount of wealth or security already, this is kind of just like with the stock market, not a bad time for investment. You see people moving up, but interest rates are low. I think we're still seeing some of that. And going through some of the things we discussed earlier and even looking at just various populations, what we're seeing though is in any recession downturn, the people at the lower socioeconomic levels are the ones that are impacted the most. And before this hit, there's been an outcry in Charlotte. We were really focusing on it here about affordable housing. And so, you know, even though maybe the higher end housing is actually doing okay right now, people are moving up, they're investing even in this situation, it's really creating a hardship for those who were on the fringes to begin with. One of the things the city has, it was started before COVID, we have an affordable housing initiative. So we already started building more affordable housing on city-owned properties. They've gone out to bid. We've gone working with the county, the Westford and Piedmont Council on Governments to fund some of this as well. So things are in the works. But I think, again, as things move forward and the economy maybe doesn't bounce back, our optimistic housing numbers and new builds may, we're hoping they stay the same level, and businesses keep coming back.
So
hopefully we can address all of the different sectors and populations.
So I think one of the things that I've found really interesting about the whole COVID-19 crisis is the way that we talk about it at a national level, but it plays out very differently in different communities around the country. And I don't know a whole lot about the housing trends nationally. I do know I was listening to a piece on public radio yesterday, driving in the car, and it was talking about the difficulties that a lot of people are having paying rent or meeting mortgage payments. And then beyond that, just the ripple effect that has is because if your landlords are not being paid, then they don't have money to invest in additional properties or keeping properties up. But they made the point that this has been particularly the case with Black and Latinx populations, that just statistically those groups have been hit really hard by this. And I think it taps into some of what we know nationally about how our economic systems work, who has money in savings and who doesn't. But I'm wondering if you can talk about that kind of at the local level. Have we seen that here in Hickory, or has it played out differently in our area?
We always see it, given the difference in socioeconomics. Think of just support safety nets that all of us have. And think of your children, my children. Right now I have a recently someone who graduated from college who cannot work in the hotel where he was working, can't find a job yet. So who picks up the slack? He can move home, he can, the support network of either family, friends, extra resources are there. So if you're at the lower end of the spectrum, higher unemployment rates in general for minority populations, not having support or family there, of course, those population groups are going to suffer during a downturn. I made the point, though, with our Latino population here, many of them their work situations have not changed much because they are in the landscaping, the construction, the service industries, housekeeping, that not all of them, but there is a population where they're working, frontline workers in general. And so things aren't maybe happening in the same rate as in other larger areas, but usually minority populations are the last to be hired, first to be fired. So in general, we have that issue, but One of the things we're doing, and as we talk about different communities, we are lucky because we have such a wonderful public-private partnership, and we have a smaller population. You know, we're dealing with 40,000 people total, and that really gives us a lot of leverage to be able to do more in terms of supporting our community members.
That's great. Thank you, Councilwoman Williams. There's a question from the Q&A from Andrew Wiesner that I think maybe Dr. Oguz could help us with, zooming back out or going back out to the macro level. He's wondering what kind of efforts, what kind of policies, fiscal, monetary, other policies, do you think would best help the poor, especially the working poor? Is it private investments? Is it government programs? Is it changing tax rates? Could you help us as an economist? What's the answer, Dr. Oguz?
Well, that's a very difficult question, right? There are so many economists are trying hard to answer that question. I think in general, the problem is we just wait to have a recession to come up with a plan. And we have this chronic problems that is waiting, and we don't address right away. But in the good times, actually, we have time and resources that we can think about those problems. And for some reason, we don't do that. And when the recession hits, in general, our low-income families are hit hard, and they don't have the liquidity that other people have. So, well, in the long run, what we can do is the best that we can do for this, minority people or low-income population is to create jobs for them instead of giving the stimulus check or instead of increasing the unemployment benefits, because you know that those are going to be for a short period of time, and you are not fixing the problem. You are just trying to, fix the, side effects of the recession, and it's not a permanent solution. I think we can provide like vocation or training to gain a new skill set, or investing in their human capital in the first place, so that we can move on, and that's going to help us to avoid the recessions, and that's going to help us to improve our long-run sustained growth. So I think the best thing is being more holistic and trying to find out how can we make sure these people are in the system and productive in the system, and we invest in their human capital. I think that's the government has, they should take the initiative, and maybe it's like businesses, maybe they should be more mindful about how they spend their earnings, and they can provide more training opportunities to their workers, no matter what kind of income level their workers have. So, but I think business side, the government side, we all have something to do to improve the overall income distribution that we have.
I wonder if I have a question but I think it ties into a question that one of our audience members has had. Phil Scott raised this question. I think one of the things that your lecture, both the recorded one and tonight, helped me to think through was why I got a stimulus check. Because I kind of thought, this seems really silly if we're finding money to help people who have lost jobs or who are struggling. Why am I getting a stimulus check? And would I be right to say that the answer is maybe we're not providing the stimulus checks to help people who have lost jobs. We're providing stimulus checks so that people will spend money. And whether I have lost my job or not, I'm probably still going to spend that money, which then helps the entire economy. I do want to hear your thoughts on if I'm reading that correctly, but it does make me feel a little bit uneasy and perhaps a little bit guilty, because as Phil points out, even if these are necessary, there's going to be an effect on long term, right?
Exactly.
So what is that effect going to be, and what is this balancing act between deficit and needed spending right now?
Very good question. Actually, I had the same feeling, like I am working. Why did I get this stimulus check? Why didn't we have more nuanced approach that targets low income individuals? So, but I think again, since they, the fiscal stimulus package passed like very fast, relatively, uh, all the fiscal, as you said, is all the fiscal policy try to do was just give the push. It doesn't matter how it is done. It's just to fix the system so that it goes on. And the expectation is when people have the stimulus checks, they are going to spend. And that was the case. That most of the people spend their stimulus check, actually 1/3 of their stimulus check in the first 10 days. So that worked. But how did it help the system? We don't know where the resources went, because with our consumption decisions, we do the resource allocation, right? We say that, well, these businesses, we shop from them and we give the resources, and in a way that we are supporting their business. But how that turned out to fix the system, or how that turned out to help the small business, for example, it's not clear yet. I think the hope was to help these businesses who are having problems, but we will see, we might see that that wasn't the case, probably. Yeah.
Dr. Oguz, sorry.
I would interject. This is probably why at that point our sales tax was not, it didn't drop. And really it's going to be the long term, because this is a one-shot deal, and the long-term effect probably won't really get at what we want to see as well. So, and real quickly, I was just going to talk about when you talked about the fixes for low income people, I just wanted to interject. Yes, jobs, opportunities, but this has been our national debate, and I think we're going to have to finally get a handle on it in terms of minimum wage and a living wage, and what brings a person from just poverty and at least having food on the table and terrible shelter to the next step when they do have that opportunity for higher education, better quality of life. And so I think this hopefully will bring us to finally that debate and look at ways that we can really, we're never going to get at the problem if we just create more minimum wage jobs. It really has to be living wage jobs and opportunities.
Gosh, speaking of that, Councilwoman Williams, there was some controversy about the CARES enhanced unemployment benefit that was discouraging people from seeking employment because of the size of the benefit, that in some places it was more than weekly wages. So I guess I'm curious here, both of y'all, do you think there's any validity to that? And then from an economist perspective, is it a problem that so many people are employed in jobs where their basic salary is less than the unemployment benefits that they would get, that there is such disparity, and so many people are making less than it costs to live, that living wage that you're referring to, Councilwoman?
Tunay?
Well, I mean, from economics perspective, I can see, first of all, this is a, not just economics question, it is both social and moral question that we need to come up with, because it was already, these people was already learning less. People who are currently on the unemployment insurance, is actually 2/3 of them were making less than what they were when they were, what they were making when they were employed. So I can see the dilemma when they are, offered the option to go back to work. They can say, okay, from personal perspective, I can see that there will be an incentive for them to not to work, because
safety, right?
Exactly. Yeah. But at the same time, that's a personal, I mean, we don't know their circumstances. Maybe they are caregivers and they don't want to, infect the elderly they are taking care of. So we don't know. From economics perspective, I can see the disincentive mechanism with that enhanced unemployment insurance. And at the same time, I'm worried because, well, from productivity perspective, these people, when they refuse to go back to work, it may take longer for them to be in the job market again because they are going to lose their spot. So I think at the end, from economics perspective, I can say that these people, we are going to lose the productivity and innovation or human capital in that case by giving them these incentives. Like
There's
that.
only so much you can fix a system that's been broken for a long time.
But I think in the first place, if we address that issue, like I was trying to say that, like if we didn't have that problem, I mean, if we made sure that these people have the savings and liquidity that they need to weather this kind of recession, I think we will have more time to think through this kind of policies, because, you know, this is going to be a difficult one to adjust once this benefit is expired.
Mhm.
You mentioned the moral and the ethical stuff that goes with this, and I wonder if you could shed a little bit of light maybe on what to me has probably been the hardest moral and ethical question of this whole thing, and that's the reopening the economy. I remember seeing in the early phases of this, I mean, I guess we're really still in the very early phases of this, right? But in the first month, a lot of my friends were posting on social media about how, you know, it's not worth the cost of lives. And I found myself, I guess I have an analytical part of me that disturbs me a little bit, because I was thinking, wait a minute, we make decisions every single day on economic lives about what is worth life and what is not. Every time I get in my car and drive, I'm making a decision that the benefit of being able to move easily with a vehicle is worth a certain human cost, right? And I even heard you'd think I'm an NPR shill here. I'm pushing NPR on you, but you know, they had a great piece on Planet Money about how economists have this kind of a value of a human life, a very abstract human life. We're not talking about my kid or my grandmother. And they claimed, at least, that the government has calculated that a human life is worth about $10 million. How do we view this from an economic point of view, the potential human loss? And then how does that change at the local level, where it's much more likely that the lives that may be lost in a reopening at the local level, there's a much better chance that this is someone I know, you know, that this is not just an abstract life anymore. So anything that you all have on that, I would be very interested in hearing.
I think you are referring to one method that we use in general to assess or to decide whether or not that we are going to go with a project, especially for public projects. Because with the private business investments, they usually don't care about these things, except that if they are developing a drug through a pharmaceutical company. But in general, public projects, they involve calculating how many people we are going to be able to save with that project, or how we are going to improve the welfare of the society. So in those kind of questions, including if we should reopen the state or not, that kind of question, we are faced with this cost-benefit analysis, where we need to find all the benefits associated with that decision and all the costs associated with that decision, and we come up with this answer. I mean, economists, they are number people. We don't make the decision. We just provide that to, you know, policymakers, and they are the one who decides on that. But during that process, we use this statistical value of a statistical life. And there are so many different methods of calculating that. And when I was teaching a public finance class, and when I was teaching that, it was very hard to convince people to say a human life worth this much, like I think 10 million. And it was so, it's open to debate, right? This method is criticized. But I think from economics point of view, since we are number people, I think we come up with that kind of cost benefit analysis. But I came across to a study, they did that. Although I don't think it's a good idea to do this cost benefit analysis, because in general we have to know all the indicators. In this case, we don't know how many unknowns we don't know. So there are so many things that we don't know yet that we are aware of. So I think this is not gonna work. That's one thing that I don't recommend doing during this period. But that study that I'm referring to, I think they calculated the benefit to be like $11.5 trillion. And they look at the cost and they say we should extend the stay home orders, but policymakers, they didn't follow up with the suggestions. So again, from economics perspective, when I look at the numbers every day, my heart is broken, because these people are individuals, they have families, and it's sad to see those kind of people suffer that much. And on top of it, even just you are looking at by the economics perspective, we are losing their human capital. I keep talking about that, but that's how we look at this. So yeah.
And that's one of the things that I've loved about this course, is that it pulls together so many different perspectives. That last week we had literature, and as an English professor, I'm saying when literature helps us look at something like a pandemic, it's really focusing on those individual lives and having empathy for the people who are suffering and experiencing this. But we need the economic perspective too. And that's also not to say that the economics professor doesn't have the literary perspective. It's just the different disciplinary ways of thinking that I'm finding so fascinating. Councilwoman Williams, what about at the local level? I mean, how do we think this through?
It's really a tough question, because we as council members, even though we actually depend on our local county and the state to initiate like a mask ordinance. We don't, it's just think if Little Hickory just did a mask ordinance, what would that really mean with, people, they just go to Newton, go out and then get the disease or whatever. So the statewide is really kind of what we look to. I think what we're looking at right now, the reason why we're so skewed, open, close, is because there's so much unknown with the disease itself. Most people do not feel the full risk of going to the store or going to a bar or going to a restaurant thinking they're going to catch this disease. We keep hearing about it, but the numbers here locally are still saying, well, everybody's doing it, and I don't know one person that has gotten it yet. And so I think the numbers are going to really start getting people to maybe be more fearful. On the other hand, there are people really that need that paycheck and the job and their business to sustain their life in general for their family. So there's that push and pull in terms of the economic need, the actual uncertainty with the disease itself. You keep hearing people saying, well, more people die from the flu. And, if we really dissected the numbers in this area, we could still probably see some of that. But one of the things that I think kind of on the policy level would work more is a compromise. If we are going to open up, I think there needs to be safety measures in place to minimize the risk of transmission. And that's, I guess, where the governor is coming from, where the state has mandated the masks at least, even though who knows how enforcement is going to work. But I think there's a compromise in all this, especially until we get a vaccine and fully understand transmission and the full risk. Right now, people are not feeling that risk.
Dr. Fisher, I really appreciate what you were saying about these different interdisciplinary perspectives. And Dr. Oguz, I love what you said about economists can focus on the people too. Like we see the people who are behind the numbers. I wonder if you wouldn't mind getting a little philosophical here with us tonight. So one thing that seems characterizes economists is that bigger is better. The bigger the economy gets, the happier economists are. But in contrast to that, one criticism is that consumerism is rampant and it's not without its costs. Do you mind, Dr. Oguz, talking about that tension? Do you feel that tension?
Well, I think economists are, they are aware of that size of the economy matters. But they are aware of the shortcoming of that assumption. I think it became a problem when society or the policymakers, they got this idea that, well, we have to have a higher GDP. That became a norm. So I think the system altogether is not sensitive to see these fluctuations in the GDP. The GDP for economists is just only important because we are saying that, oh, that's a good measure to track because it is correlated with higher standard of living. We leave it there. But I think that information becomes so important for many other players in the market. Then I think we had that assumption that it has to be bigger and bigger all the time. But it's okay to say we like to have a bigger economy, because it's okay to ask for people to have higher earnings, right? Because if we are producing more, we can earn more and we can invest more in education and other things like art and books and stuff. I think that's okay to say that, but I think what is not okay is to push the consumer spending all the time to get there. I think we have other mechanisms that can be done to improve the GDP. So we can ask people to save more. If they save more, businesses will have more resources to invest in their research and development and business fixed investment. And then through that saving mechanism, we can push the GDP because we are improving the business investment, which is actually a much better method of increasing the size of the economy. I think consumer spending is the one method that is short term, is very easy. The other one is it takes time, so people don't have the patience for that. I think that's why people are pushed to do that. For that consumerism, I think we still have the option to be mindful about that. Well, we may make decisions based on, for example, okay, I'm gonna spend this money, but should I buy my favorite bag, or should I invest that money to learn a new language, something like that? Even that kind of an approach, like shifting the consumerism, will even help to sustain the growth, but at the same time being mindful about our resources.
I wonder if we can do kind of a quick lightning round to get in 2 more questions. Each of you gets a 1-word answer with maybe like a half a sentence explanation. So I saw this one come in just a minute ago. I don't recall who it was from, but better to spend our money locally or on the big corporations that are driving the whole economy? Dr. Oguz.
Both.
Both. Good.
Both, oh yeah, okay. Go ahead.
Councilwoman Williams.
I'm skewed towards local, but understand we need the investments. Large.
Okay, and our last question, again, very, very quick answers because we are at 7:59. Dr. Oguz, is there a country that you would look to for policies that have worked well? And if so, which one?
Oh, that's a hard question. I will say Germany. Okay. And because actually yesterday, for some reason, I looked at their components of the GDP. Their consumer spending was about 50%. And I'm like, okay, then that's possible to have a large GDP, big size of economy with relatively lower consumer spending. So, yeah.
Awesome. And Councilwoman Williams, we won't put you on the spot for a country, but a city that you would look to for who's doing it right.
Hickory, of course. No.
Great answer.
Thank you all so much for joining us here tonight. We are out of time, but just a little bit of a teaser for next week. I know many of us, including people on this panel, are waiting with bated breath to see what the plan is going to be for the school year next year for the governor's decision, right? And just in time for that decision, we will be joined by Dr. Monica Campbell, who will be talking to us about the impact of the pandemic on education and talking as well as about disparities across the digital divide. So you can look forward to that next week. And we thank you for joining us here this evening. And a special thanks to our guests here tonight, Dr. Oguz and Councilwoman Williams. Thank you.